Om Namami Dhanmantarim Adidevam Surairvandita Pada Padmam Loke Jararubhaya Mrutyunasham Dataramesham Satatam Namami. Good afternoon to everybody. Namaste. Today,
Namaste.
we are going to discuss about the Ayurveda principles of management of Pakshaghata, Hemiplegia, with a special reference to Virechana. Virechana has been told as the main principal treatment of vataja roga. But in vataja roga, why they have told this, I would like to discuss at the end. But now, let us actually understand Pakshaghata. What is this Pakshaghata? Everybody knows about it, but still I would like to just say a few words about what is this Pakshaghata and the hemiplegia. Along with me, Dr. Aswati is also here. She will also speak in between about the Nidana, the Samprapti Ghataka, Samprapti, and all these things she will also discuss. Pakshaghata is one of the 80 types of nanatmaja Vatavyadhi. Paksha means everybody knows that one side of the body, and aghata means that there is a destruction. Destruction or loss of voluntary functions of one side of the body is called as Pakshaghata or Pakshavadha. This disease is so common. About 10% of the patients in neurological diseases, they suffer from this disease. In Ayurveda, Vatavyadhis, 80 types of nanatmaja Vatavyadhi means, only because of the Vatadosha, there are 80 types of diseases are there. 40 types of diseases of Pitta, 20 types of nanatmaja Kapha dosha, Kapha rogas are there. So among 80 types of nanatmaja Vatavyadhi, this is one of the major diseases. It is actually akarmanyata pradhana Vatavyadhi. In the, Chakrapani has actually explained so well in his commentary. There are different types of Vatavyadhi. One is actually akarmanyata pradhana. Akarmanyata means loss of function. Akarmanyata. The karmendriya hani is there. Karmendriya hani, akarmanyata pradhana. This is all the other symptoms will be there. But akarmanyata is the main. In the same way, in some diseases of vata, kampa pradhanata will be there. That is called kampa pradhana Vatavyadhi. In some diseases, shula pradhana, that is pain is very, very important symptom. That is the pradhana, that is called shula pradhana Vatavyadhi. Shosha pradhana Vatavyadhi. Stamba pradhana Vatavyadhi. Supti pradhana, like this, lot of categories have been made in Vatavyadhis also. This is actually, this Pakshaghata is akarmanyata pradhana Vatavyadhi. This is a madhyama roga marga vyadhi. And also it is characterized by cheshtahani. Cheshtahani means loss of voluntary functions is called a cheshta. Cheshtahani, loss of voluntary functions. Achetana, it may be unconsciousness, or it may be loss of sensation. Hastapada sankocha, there is a contractures, spasticity in the affected upper and lower limbs. Shira, snayu, shosha, there may be abnormality in the vessels, arteries, and also in the veins. Shira, snayu, in the ligaments and also in the muscles, there will be abnormality. And that is, the shosha will be there. The abnormal structure will be there. Vakstamba is one of the symptoms, mainly in a few cases, those who are having a right-sided hemiplegia, or those who are having the speech center in the left side, there is a dominant hemisphere. So in such condition, the Vakstamba we always see in the patients. Vakstamba and Ruja, only very few patients will be having pain because they are not able to move at all. They're continuously sitting in one, there will be pain. Of course, we are going to discuss all these things, when the Lakshanas we are going to discuss. And the sandhi bandha vimoksha, there is actually loosening of the sandhi, that is shoulder joint, usually it droops, and then that is sandhi bandha. All these, lakshanas have been told. Not only these lakshanas, there are so many other lakshanas which we are going to discuss later on. It is mainly because of the vata vruddhikara ahara vihara. There are so many, the ahara which are going to increase the vata dosha, even the vata prakriti people, vata kala, vruddhapya, that is, vayoho ratri bhuktanam te antamadhyadika kramat. In old age, this is a very common problem in old age, because of the vata dosha pradhanata. And also, either it is due to the marga avarana or marga avarodha. Marga avarodha, everybody knows, all of you know about, when the circulation is hindered, or when there is obstruction in the circulation in the middle cerebral artery in the brain, marga avarodha takes place, and suddenly the Pakshaghata takes place. So well, Ayurveda definitions, Ayurveda explanations are there in Ayurvedic texts. The same thing is adopted actually even in the ultra modern medical science. Dhatu kshaya, all the dhatus, if the kshaya takes place, when there is a stroke, where the blood supply is not available properly, dhatu kshaya takes place in that area. Not only in that area, sarvadehika dhatu kshaya also is going to cause the Pakshaghata. Pakshaghata may be compared to hemiplegia or hemiparesis. There is a difference between hemiplegia and hemiparesis. All of you know about it. Hemiplegia is a total loss of the voluntary functions, the muscular functions are lost. Actually, the movements are lost completely. The muscle power is zero. That is called hemiplegia. Hemiparesis is actually partial loss of partial loss. It is not complete loss. Person is able to move. Person is able to do some movements. It is a partial loss. Hemiparesis. Call actually those people may be having, in the initial stage hemiplegia, but later on with the treatment, with the physiotherapy, with all the other movements and vyayama and other things, proper food, proper lifestyle, they become hemiparesis. Very few people, they become, 100% normal. Otherwise, they will be suffering, in their whole life. Hemiparesis. The condition may improve with the treatment. And these are all, different types of paralysis have been mentioned in modern medical science. It may be monoplegia, only one hand may be affected. It may be polio, only one leg is affected. Ayurveda also the same kind of, explanations. Ekanga ghata, monoplegia, hemiplegia. Hemi means, one side of the body. Hemi, one side of the body. That is Ardha Narishwara. Or Paksha, what we say, Pakshi, Paksha. And then, the Krishna Paksha, like this one half of the body is actually, this is called hemiplegia. Paraplegia is also another varieties of the paralysis only. Paraplegia is a adharanga ghata or pangu. Adharanga ghata is also, the paraplegia. It may be quadriplegia, complete diplegia. So in this way, the paralysis is actually of different types actually. But hemiplegia we are dealing with today, and we will discuss about this particular disease in detail. It is one of the major neurological disorders manifested as loss of voluntary functions of one side of the body. Hemiplegia is usually a complication or the sequel of the cerebrovascular disease. Cerebrovascular. The circulation to the brain is hindered. Circulation to the brain is not actually, it may be a very partial loss of circulation. It may be a sudden circulation loss. It may be some obstruction which is there in the artery which is not supplying. It may be partial. It may be full. So if it is a full, usually it is full. So then it is stroke. We say it is a stroke. So cerebrovascular diseases are stroke, and is manifested by abrupt onset. The person is fine, but suddenly he develops actually. Usually suddenly he develops. But there are few cases where it is a very slow process. like in the neoplasm, a growth, is there inside the brain. A very slow process may be there in this way, or a person met with an accident, suddenly, he may lose, or there may be hemorrhage. They slowly, he may lose. In this way, it happens by abrupt onset of the focal neurological deficit. It is upper motor neuron lesion. It is upper motor neuron lesion. It is in the brain. It is the brain cells are involved. Upper motor. We can differentiate very well, the upper motor neuron lesion diseases and also lower motor neuron diseases by the examination only. But this hemiplegia is an upper motor neuron lesion disease. It is usually caused by hypertension. Hypertension is a major cause. Diabetes mellitus is the second major cause, one of the causes of this hemiplegia. If at all hypertension and diabetes are combined, the risk factor is too much. Risk will be too much. So it's a bad combination, hypertension and also diabetes. Dyslipidemia, if at all they have even dyslipidemia, the cholesterol level is very high. Total cholesterol or triglyceride or LDL cholesterol, these are very high. If the HDL cholesterol is very low, in such condition, this is a triple danger problem to the patient. So that's why everybody should be taking care of all these things. Neoplasm, a growth, a tumor, or any such kind of thing may also slowly, grow inside, and then it may cause the loss of or the obstruction in the flow of the blood. Head injury also suddenly may cause the hemiplegia. In modern lifestyle, dietary habits, lack of proper exercises, injudicious way of physical activities, and mental stress and strain. Nowadays, everybody is having too much of stress, mental stress, physical stress and strain. Mental stress has become very much, in the modern lifestyle. This is one of the major causes of hemiplegia. Now, the stroke, cerebrovascular accident, what we say, CVA or stroke, occurs when the blood flow to the part or some part of the brain is stopped. Depending upon that, the hemiplegia takes place. So blood flow to a part of the brain is stopped either by a blockage or a rupture of the blood vessels. Either it's a blockage. Blockage is called ischemic stroke. So in the stroke, there are three types of strokes. Ischemic stroke involves a blockage caused by either by a clot or by plaque in the artery. A clot, clot in the sense, if at all a person is having too much of cholesterol and it is going to accumulate inside in the intima of the arteries, then when it is going, then what happens actually, a small, this one, clot may go from there, and then it may obstruct the middle cerebral artery, and then it may cause sudden hemiplegia. 90% of the stroke are because of this. That is called thrombotic stroke. Emboli is actually a small, a piece of any kind of emboli. It is coming either from the heart or from any other part of the body, going to the circulation. When there is an aorta, in the aorta there are three branches. When it is going through the common carotid artery to the brain, it obstructs. If it obstructs only, depending upon the obstruction where it is, that kind of paralysis may take place. If it obstructs in the middle cerebral artery, then it actually becomes a very. So this is the ischemic. This is the ischemic stroke. And the second one is the hemorrhagic stroke. Hemorrhagic stroke is actually, there is a hemorrhage. A person who is having very high blood pressure, usually he is the one who gets the hemorrhage. Hemorrhagic stroke. There is a person becomes unconscious, and if he recovers immediately, the treatment is given. Probably he may recover. Hemorrhagic stroke is caused by burst or leaking blood vessels that seeps in. Transient ischemic attack is another variety of stroke that comes and goes. Temporary he is lucky that, he has come back. A temporary attack will be there. A small clot, which is actually largely in the middle cerebral artery, may be causing, this kind of thing, but just touch and go. Such kind of, the stroke will be there. That is called TIA. That is called transient ischemic attack. This involves a blood clot that typically it can be reversed on its own. It is reversed. That is called so. And some people may be having a atherosclerosis also. The tortuosity may be there, or inside the artery there is a accumulation of this one. What is called any kind of substance which is there, or the cholesterol, if it is accumulated inside, then it may cause atherosclerosis. In the old age, what happens actually, atherosclerosis is very common, arteriosclerosis are very, very common. So that also causes a stroke. So these are all the 3 different varieties of stroke. According to Ayurveda, the Nidana is actually, Nidana, a separate Nidana has not been given has not been explained for Pakshaghata. For all Vatavyadhis, they have explained a common Nidana that is called Ruksha, Shitalpa Lagdhvanna, Vyayamati Prajagaraha, Vishamat Upachara. See, Ruksha Ahara, Shita Ahara, Alpa Ahara, Laghu, and Akala Bhojana. So untimely food. Untimely food, if anybody takes, the Agni will not be able to understand how to digest the food. In such condition, Vishamagni is going to cause the ama. Even this cholesterol is ama. The diabetes, in diabetes, the blood sugar which is there in the blood is ama. Any such kind of thing which are there, even the uric acid which is there excess in this is the ama, because it has not been digested properly. So this ama is the main cause for all kinds of diseases. But when it increases, when a person takes a ruksha, shita, alpa, all these types of food, usually his vata gets aggravated, and vata is the one responsible for controlling the nervous system. Vata system, nervous system, both are actually similar. Everything similar. Ama produced, because of that, he is going to cause this kind of problem, that it may cause a Pakshaghata. Vihara, Ati Vyayama, Ati Prajagara, all these things are going to increase the Vatadosha. Vegadhana, Shigrayana, Ati Vyabhaya, Vishamat Upachara. People who do not know Ayurvedic specialists, who do not know how to conduct the Panchakarma properly, they will actually end up with many, many things, because, what is Ati Yoga? What is actually, everybody should be knowing about all these things, Ayoga, Samyak Yoga, Ati Yoga. Usually the Ati Yoga of all such kind of upachara are the Panchakarma, going to lead to many, many diseases, not only this Pakshaghata, but this is one of the diseases where Acharyas have told Vishamo Upachara. Vishamat Upachara is one thing. Atidosha Shravana. For example, we are actually taking out the Pitta dosha by Virechana. So Virechana, Pitta dosha has gone, Vata has gone, even the Pitta Shravana has taken place. And after that, even the blood may go out. Atisravana, or too much of elimination of the Pitta dosha, too much of elimination of the dosha in the body, even the Rakta, too much of elimination may also cause. Or Ati Asrak Sravana, because of anything. A person who is having too much of piles, a person who is having vomiting, or any ulcerative colitis, Ati Asrak Sravana may cause Vata Vruddhi, and in turn it may actually cause different kinds of diseases, and I will not go in detail of all those things. Ati Langhana, Dukkha Shayya Asana, abnormal posture of lying, abnormal bed, abnormal, these are all the things which are going to cause Diva Swapna. You may say that Diva Swapna is going to cause increase the Kapha dosha. Yes, Kapha dosha may increase, but he will not sleep in the night time. Then, the Prajagara takes place. When Prajaghata is taking place, then, this in the Ratri Jagarana, when it takes place, Vatadosha takes place. Any kind of abhighata is also another reason. In this way, the acharyas have given a lot of different causes of this one. Manasika karana, chinta, shoka, krodha, bhaya. These are all the things which are actually cause of pakshaghata. Anya karanas are also there. Roga. Roga means any other disease which is going to cause, for example, diabetes. For example, the hypertension or hyperlipidemia. All these things are going to cause. They are the roga. This one, nidanarthakara roga. Nidanarthakara, one roga is actually leading to another disease. Marma abhighata. Marma abhighata, if it takes place, in the adhishta, this marma, especially which is there in the brain, if that marma is actually, when some accident takes place, and such an abhighata takes place, then also, a person may develop dhatu also takes place in this way. Lakshanas, as I told, the lakshanas is ardha sharira cheshta nivritti is the main symptom. So he is not able to actually control. There is a loss of control, loss of voluntary function. Involuntary, inside the organs, for example, right side, the lung is there. Lung is not, that is not a voluntary this one. So that is not actually, involved in this one. Voluntary functions of the body only they get affected in Pakshaghata, Achetana. There may be some kind of loss of consciousness in some condition and loss of sensation also in some condition, not in all conditions. Hastapada Sankocha and Samba. That is, you have seen the patients of Pakshaghata, they have a lot of contractures, they have spasticity. Spasticity in the upper and lower limbs of one side of the body, and increase in the muscle tone is there. When you try to flex, on their own, when they are doing it, it is moving. But when you are actually taking forcibly taking, flexing and extension, when you are doing it, then they will not be able to do, because it is so much of rigidity is there, so much of tone is there. When the tone increases, this is called hypertonia. So in upper motor neuron lesion, especially in this Pakshaghata or hemiplegia, increase in the muscle tone will be there. Muscle power is less, muscle tone is more. So we have to actually do, when we do the Panchakarma and other things, one should know, all Panchakarma physicians should know how to do the massage on that, increase in the tone of the muscle. Not doing the massage in the same way as this one. How to do the massage in the lower motor neuron lesion? How to do what kind of oil is to be used in the lower motor? All these things are there. Actually, tone is very, very important. How to do the massage? How we have to. So anyway, Shariram Patati, body falls down. This is the combination of symptoms I have told from Charaka Shushata and Vagbhata and Madhavanidana all mixed together. So Shirasnayu Shosha. Paksham Anyataram Hanti. See, wonderfully they have told. Paksham Anyataram Hanti. Opposite side of the body gets affected. How wonderfully, those people were having, good knowledge about all these things. Shira Snayu Shosha. Shira and Snayu, the ligaments and, kandaras, and also Shira, these dhamanis, veins and also arteries, all these things will be having abnormality in the blood vessels and also in the ligaments. Mukha Vakrata. Mukha Vakrata is bhru. If you carefully see, the person who is suffering from the hemiplegia, the bhru will be actually, will not moving at all. It doesn't move properly. One side is properly moving, the other side is not moving at all. Lalata doesn't move. And then Nasa. You must have seen patients who are having nasolabial fold in one side, another side this. They can't actually, ask them to show the teeth. You will be seeing one side of the face is actually deviated. Mukha Vakrata. That is called Mukha Vakrata. Jihva Vakrata. Hanu. If you see the Hanu, their shape is totally different. In that way it happens actually, whatever it is. Vaksanga, aphasia, dysphasia. Sandhibandha Vimoksha. Actually, Sandhibandha Vimoksha, why it happens? Because the limb, usually the upper limb is so heavy, when actually, the muscle is so heavy, because that heaviness, that cannot take the weight at all. Because of that only, there will be some space in between the scapula, this clavicle, and also the humerus. So between that, there is, you can put a finger and then understand that, oh, there is a sandhibandha vimoksha, looseness of the joint, especially in the shoulder joint. It may also take place, in some cases, even in the hip joint, it takes place. Ruja, toda, pain. Yes, if the pain is there, then it is a good symptom actually. So toda and ruja is there only in some cases. Why? Because it is actually, they are not using it properly, and then muscles, they get tired, and then they start getting pain. So these are all the same lakshanas which we have in anubandha. So it is actually the Vatavyadhi, but still anubandha, pitta anubandha, kapha anubandhas are there. Pitta anubandha lakshanas are daha, burning sensation, santapa, the feverishness, murcha, delirium, or unconsciousness. These are all the symptoms which are there, which have been explained in Ayurvedic textbooks. And then kapha anubandha, shaitya, shodha, gaurava, cold sensation. And swelling and heaviness. These are all some of the symptoms in Kaphanabandha Lakshana. And Chikitsa Sutra is actually Daiva Vyapashraya Chikitsa. I will not go in detail of all these things. Daiva Vyapashraya. You have to pray God. It is the only ultimate treatment is that only. Pray God. And Yukti Vyapashraya, judicious treatment actually, how to actually, you have to understand the Prakriti, Vikriti, Sara, Samhanana, everything you have to understand according to Ayurvedic or according to whatever the medical system, you have to understand and then adopt a scientific treatment according to that particular system. That is called Yukti Vyapashraya Chikitsa. Nidana Parivarjana, all these things are there. So Sattva-vajaya, mind is to be, taken care. If at all the person is having a very good, strong mind, he will come out of the disease very well. So Sattva-vajaya, and then this is the first line of treatment. Then Nidana Parivarjana, Sankshepada Kriya Yoko, Nidana Parivarjanam, correction of the Ahara and Vihara. Shodhana, Shamana Chikitsa, Ama Pachana, Shoto Shodhana, Snehana Swedana, Vatasya Upakramaha, Sneha, Sweda, Samshodhanam, Sneha, Sweda, usually Kayaseka, Pindasweda, followed by Mrudu Samshodhana, all these things. Anuvasana Basti and Astapana Basti. Virechana, I have written bold letter here because in Pakshaghata, Virechana has been told. I'm going to explain a little later why Virechana. And then Nasyakarma is very important, Shiro Basti is important, Shiro Dhara, all these things, and then Vyayama. In allopathic science, what they do in modern medical science, they do the treatment and then they tell the patient, you just follow only the physiotherapy, nothing else. And then, so Vyayama is very, very important. Yoga, Vyayama, we also adopt, all these things in Ayurveda, and we can see good results. And then Swedanam, Sneha Samyuktam, Pakshaghate, Virechana, all these things have been told. Now I will tell you about a case. A very, very interesting case. This person, a Muslim person, Muhammad Anwar Anbi, he had come from Afghanistan. Patient, 52 years old, male, occupation, he was a military commanding officer. He came to us, in the wheelchair, and he came as an outpatient to us, in 2021, in the month of January, and again he came to us because he got some improvement. That's why again he came in the month of. So in the month of January when he came, so he was here with us for about 23 days, but he did not get admitted. It was only the OP treatment because he wanted to stay outside and then come here, in spite of our insisting him to get admitted. Phase 2 is, 6th of April to 26th of April, for 20 days he was here with us. The history is like this. On 20th of December 2020, around 10 a.m., the patient was sitting at his home in Afghanistan. He was taking tea. At that time, he told his wife and also his people who were there that he was not feeling all right. He was feeling some uneasiness, some giddiness, he told. And then, he was also having some kind of, within no time, he suddenly fell down. he was unconscious. He was admitted to the military hospital in Afghanistan. He was unconscious for 24 hours. More than 24 hours he was unconscious, and after gaining consciousness, he came to, he has lost control on the right side of the body and was unable to speak at all. In 2-3 days, he was able to understand what is going on. Simple commands, and he was able to communicate with the left hand gesture. His CT scan of the brain revealed left middle cerebral artery infarct with mild hemorrhagic changes. After a week, he was admitted in the neurology department of Medanta Hospital. They came from Afghanistan to Delhi. Medanta Hospital, they admitted under a neurologist in the neurology department. On 28th of December, he was admitted. Conservative treatment and all allopathic treatment, proper allopathic treatment. He was conscious. He was conscious. Allopathic treatment was given, and he was discharged on 6th of January. From 28th of December, he was there. Say up to 6th of January, he was referred to Ayurveda department. Then neurologist Dr. Arunkar, they referred the case to us. But on the same day, the patient did not come to us. The patient came to Ayurveda Medanta on 12th of January. At that time, when he came, he was on stretcher. He was on stretcher. He was not able to move at all. His muscle power was zero in the right side, affected side. Weakness in the right side of the body since 22 days. Loss of speech. This we recorded on the day when he came. And then bowel and bladder not under control. Rigidity on the right upper and lower limbs. Heaviness in the right side of the body. Dribbling of the saliva. And mild weakness on the right side of the face. And depression. He was depressed. Actually, he was almost crying, not actually talking, not showing any interest to talk at all, because he was a very active person in the military. Now his condition has become like this. He is very depressed. Then past history was actually, he was having some dyslipidemia and obesity. His weight was more actually. It was 88, 90 kilos earlier, and occasional fluctuation in the blood pressure used to be there. And he was not taking proper medication. He was on irregular medication. The family history was actually his mother was having high blood pressure, and uncle had high cholesterol and also stroke. His personal history, he used to take alcohol, smoking, irregular timings of the food, and too much of meat and too much of this one. No timing of the food at all. All these things were there. They are all going for according to the Ayurveda, the fatty food. Now I request Dr. Aswati to take over and then go further, to understand this.
His sleep was poor, Agni was Vishama, bowel was Sama, urine was catheterized, mind was weak, confused, depressed. His ojas level was very low, well-being was poor on a scale of 1, BP was 130/80 and was on allopathic medicines. Pulse was 82 per minute. Weight was, we were not able to weigh him, but he was told to have 88 kilograms of weight. His diet was very poor. Exercise was passive and lifestyle was poor. He was having a height of 5 feet 9 inches. His nadi was Vadakapha. His jihva was Anubalipta. Malam was Aniyandrita. Mutram was Aniyandrita. Shabdam was, there was loss of speech. Sparsham was Anushnachita. Drik was Sadharana. Akriti was Thula. His Prakriti was Vadakapha. Vikriti was Vadakapha only. And Yogabala was Pravara. Sara was Madhyama Sara. Samhanna Madhyama. Pramana Pravara. Satnya, Sarvarasa Satnya. Asatnya, we were not able to find out any Asatnya in his. Sattva, Avara to Madhyama. Ahara Shakti was Madhyama. Vyayama Shakti was Avara. On physical examination, the motor function on the right side, there was complete loss of function on the right side. Left side, it was normal. Sensory function was normal on both sides. Muscle power of upper limb was 0/5 on right side and 5 normal on the right side. Muscle power on the lower limb was also 0/5 on the right side and normal on the left side. His muscle tone was increased on the right side while it was normal on the left side. The deep tendon reflexes were also exaggerated on the right side. His shoulder joint there was loosening in the shoulder joint on the right side, and left side it was normal. There was weakness in the right side of facial muscles while it was normal on the left side. In the lab investigations, he had elevated lipids, like total cholesterol was 260, triglyceride was 294, SDL and LDL were normal. His vitamin B12 was also normal. Vitamin D, he had a low vitamin D levels, 18.9. And his thyroid, hemoglobin, platelet, everything was under normal limits only. His kidney function tests were also normal. His blood sugar was 6.3 on the borderline, and LFT was normal. But his urine examination showed proteins present, erythrocyte present, and there was high pus cells 77.7, epithelial cells 6.7, RBC 69.6, and bacteria 84.6. Mainly because of he was catheterized. That is why. And while doing the Roga Pariksha, mostly the Nidana was because of his Ruksha, Viruddha, Shita, Mithya, and Agala Bhojana. He was taking more of cold drinks and not having a strict diet control. And Vihara, he was not having a disciplined lifestyle, no proper timing for food or sleep or anything. In Manasika factors, there was a lot of stress and depression during his work time itself. He was usually a stressed person, and he was having high cholesterol levels, high lipid profiles, and BP also was high, which he was not taking regular medications to control it. In the Purva Yuba, just before the onset of the stroke, there was headache, slight confused state of mind, slight giddiness. They were explaining that, and numbness and weakness was also present. There was loss of in Ruba. There was loss of voluntary motor functions in the right side of the body, loss of consciousness for about 1 day, bowel bladder incontinence, spasticity in the muscles of right side of the body, loss of speech, dribbling of saliva, etc. Samprapti Ghadaga. The dosha was Vada Pradhana. All the 5 Vadas were involved: Prana, Vyana, Udana, Samana, and Apana. And also Tridosha involvement, Kabana Bandha was there. Doshyas involved were Rasa, Rekta, Mamsa, Meda, Sira, Snayu, Dhamini, and Mala was also involved. And Adhishtana was in Mastishka. Vyaktasthana was Dakshina Ardha Sharira. Srodhas involved was Dasavaha, Rektavaha, Mamsavaha, Pranavaha, Mutravaha, Purishavaha, and Manovaha. Srodho Dushti, there was Sangha, and then which led to Sira Grandhi, and which led to Vimarga Gamana. Agni, there was Vishama, Jadragni, and Rasa, Rekta, Mamsa, Medo, Dhatu Agni. Ama, Jadaragni, Jadaragni, Mandya Janya Ama, Rasa, Rekta, Mamsa, Medo, Dhatu Agni, Mandya Janya Ama was involved. Due to the Vada, Vriddhikara, Ahara, and Vihara, there was Agnimadhya, which led to Ama, and eventually Vada Prakopa. And there was Sthana Samstraya in the Mastishka. There was Shoshana of Sira and Snayu, which led to Marga Viroda or Sangha. And there was Dadukshaya, Rekta Dadukshaya was there in the Mastishka. And there was suddenly loss of function of opposite half side of the body, which is Pakshaghata.
So now treatment, actually, what treatment we did So the treatment is actually, he was not having too much of Ama Lakshana when we saw him, but slight Ama Lakshanas were there. And Ama Pachana, we still, we gave Ama Panchakarma,
Sir,
around
please
2
mute.
tablets we gave for 2 times a day for 2 days. And we also gave Kashayam, Dhanada Nayanadi Kashayam, 15 ml with water about twice daily. After food, before food we gave it. Ekanga Veera Rasa, which is usually explained by all acharyas to be given 1 tablet of, this is 1 tablet BD we have given, Ashwagandha Churna, half teaspoon twice daily after food, Sahacharadi 21 times medicated capsule, 1 OD after breakfast, and Manasamitra Vataka we have given 1 tablet at bedtime, Avipatti Karachurna, half to 1 teaspoonful at bedtime. As a Murdu Virechana, we gave it almost daily. And then Gandharva Hastadi castor oil, 4 teaspoonful once a week. At night time, we were giving, that is called Sneha Virechana. And Vachachurna with honey, Jihva Lepa we were doing, and then, little gargling. It was difficult for him to gargling in the beginning because, he was not able to hold this one inside. But we were applying the Vachachurna Lepa, and it was actually improving very well, and he improved later on so well. So then Panchakarma treatment, what we did, from the beginning, he came on 20th and 12th of January, and then we started our treatment on the very same day. We started doing the Abhyanga with the Kottam Chukadi Tailam. Kottam Chukadi Tailam we selected because Kottam Chukka is actually, Kafahara. He is a Vata Kafa person, Kafa Pradhana Vyakti, and Vata Roga. And Mahanarayana Tailam, he was complaining little pain sometimes, not always. Mahanarayana Tailam sometimes we were using Dhanvantram Tailam also. Patrapinda Sveda we were doing it in the morning time. And in the evening time, we were actually doing a Churnapinda Sveda with the Kottam Chukadi Churna and also Kolapulathyaadi Churna we were doing in the afternoon. He was coming 2 times, every day. For 7 days, we did this treatment, and after that, we did for 7 days, from 19th to 25th, Abhyanga, Patrapinda Sveda again, and Nasyakarma, we started, and after that, because why we did not start the Yoga Basti in the beginning? Because he was not able to hold, because his bowels were not under control. We were thinking of giving the Basti from the beginning, but he was not able to hold because it was coming out like that only. So we started that Yoga Basti a little later. That is in the 3rd week. We started Yoga Basti, Abhyanga, and Yoga Basti we did, and we did daily Vyayama and also yoga. We were making him to do it actually. Passive movements we were doing, and also we were encouraging him actually to do it, and we were doing a lot of counseling, and he improved. So when he went from here on 3rd of February, and he was very cheerful. He was the response. No, I'm going to come to that. I will tell you. But this treatment, we did from 6/4. Again, he came because he was so much better. Because he was much better, again he came to us, in the month of April. From 6th to 19th April, for 14 days, we did Kaya Seka with Balashwagandhari Taila and also Dhanvantaram Taila. And from 20th of April to 27th of April, Abhyanga, Svedana, and Yoga Basti again we did. Because Yoga Basti is the treatment which we had to do, in all these Vatavyadhis, but Virechana also to be done. We are doing anyway Virechana also we were doing, and also we were giving this Eranda Sneha, we were giving in the night time once in a week. 20th of April to 27th of April, we did a Shirodhara treatment with Shirabala Taila and also Baladhatriyadi Taila we were using. So the diet and exercises, we were actually telling our dietitians when they come here, we were telling them that to give a very, very light food, only vegetarian food. So breakfast, we were giving dalia and multigrain bread and fruits and toned milk. Lunch, we were giving him roti, little different food, but this is the usual standard food, we were giving with light vegetables, brown rice, moong dal, masoor dal, sometimes arhar dal, some salad, and buttermilk, And dinner, little bit sometimes change. We were giving, khichdi and vegetable soup, and the low salt and low fat. Because of his too much of cholesterol, we were actually restricting all these things. Because of his blood pressure, we were restricting it even that, because he was taking allopathic treatment. We continued the allopathic treatment also, and then exercises, passive exercises we were actually doing here to improve his muscle strength morning and evening. For about 30 minutes, we were doing the exercise every day. And he was encouraged to do exercises himself with the help of left hand. We told him how to do it, how to do the exercise. We were telling him, he was doing it. Daily counseling, and then yoga, pranayama, and meditation, we were giving him to do all these things. So then, we, after about, 2 phases of treatment, we understand it was, his sleep was so much better. He was able to sleep very well. Earlier he used to dream a lot. Now, he was not having any problem, and he was having good sleep. Agni was earlier it was a very Vishama. Now it has become Sama. That is now in the sense that is on 26th of April. First one was 12th of January. This is the cumulative effect of the whole treatment of first phase and second phase we have combined. And our bowels were actually Sama. It became Nirama completely. Urine was catheterized. When he went after the first course of treatment, it was much, much better. He was having control, but still he was having slight incontinence of bowel and urine when he went after the first course of treatment. But after the second course of treatment, it was completely under control. Mind was very weak and confused and depressed. He was not ready to take any treatment. But we encouraged him, and then he was very cheerful and very positive when he went from here on 26. Ojas was low, it was medium. It was well-being was actually, it has improved from 2 to 4. BP was 120/80 after the treatment. Pulse rate was 78. Weight was actually 85 kilo. Only 3 kilos he had reduced. When he went from here, he was eating very much. He was happy. Still, he did not actually reduce the weight. We had told him to come back, with at least 10 kilos reduction in the weight, but, his weight was only 85 kilos. So diet was very poor earlier. Now it has improved, at the end of the treatment. Exercises, we were doing all passive movements. Now he is able to do on his own, the exercise. Lifestyle has become much better. We have told him what time to get up and what to do, how to do, all these things we told him. He is following all these things thoroughly. And then next. Now outcomes. Outcomes, you see, the first phase after OPT treatment and second phase of OPT. And then the dates I have mentioned here, he came on 12th and he went of the first phase of treatment on 3rd. It was completely, bowel control was completely incontinence. He was not having, so we were putting the diaper we were actually putting, and incontinence was there. When he went from here, fairly good control, but it was not completely under control. And then when he came on 6th of April, it was a better control. But when he went from here, he was having complete control on the bowel movements. In the same way, the bladder control was also in the same way. It was very much better. He was having very severe depression, 4/5 depression, and then it was improved by 2/5, when he went from here after the first phase of treatment, and after the second phase of treatment, it came down to 1/5. That was really, he was very, very cheerful. He started even singing. So in this way, he was very, very happy. His movements, when he came here, it was a bedridden, he was on the stretcher. And then after the first phase of treatment, it was, he could stand with support and walk few steps. We were not very happy that, even after taking 3 weeks treatment, we were not able to do much. We were thinking, but when he went from here at home, he started walking much better. Then that's why he came back to us to take the treatment. He could walk actually, when he came with support. Then when he went from here, he was not having any support of walking, but he was walking with hemiplegic gait. Yeah. So outcomes, muscle power, right upper limb, in the beginning, before the treatment, it was 0 in the right upper limb. And then the first phase of the treatment, 1 to 2 only, just 1 to 2. No improvement, much of improvement was not there. Then, he came again with the same kind of muscle power in the right upper limb, on 6th of April. And 26th of April, his muscle power became much better, right upper limb, 3+, 3+. And we were having a lot of good parameters to assess all the improvements actually, but now I will not be able to tell all those things, but the only major things I will tell you. Muscle power right upper lower limb improved a lot. That's why he is able to walk. It was 0 to 1. When he went from here after the full 2 course of treatment, it was a 4+. Muscle tone was right upper limb muscle tone was 3+, 3+. And then at the end, it was 1+. Muscle tone decreased. He was able to walk better. Even though the tendon reflexes were still there, clonus had reduced very much actually. So in this way, we can understand. So muscle tone, in the right lower limb, it was 2+ earlier, and then it became 0 to 1, or we can say 1 to 0. In this way, we can say speech. He was not able to speak at all. He was having this very slurred speech, in the first phase, the end of the first phase of treatment, can speak much better, but he could speak much better after the complete course of treatment. Dribbling of saliva was there earlier. It was there even when he left from here, in the first phase. And after that, there was no dribbling of the saliva. We have so many other parameters, like, we were giving him water, fill it in the mouth, don't allow it to go out. So he was doing it, but in the initial stage, it was going out completely. But when he went from here, he was able to hold, everything properly, even the liquid, all the liquids properly in the mouth. So such kind of improvement was there. And NIH stroke scale, I will not be able to, now not much of time, but still I tell you, this is National Institute of Health stroke scale is there. This stroke scale indicates this is the systematic assessment tool that provides a quantitative measurement of the stroke-related neurological deficit. It is actually a clinical assessment tool to determine how much deficit is still there, and what is the treatment which we have to do, where we have to concentrate the treatment. In this way, this we learned, from the neurologists, and then these neurologists actually were doing all these tests. Then we also tried to adopt. If at all it is 0, there are actually 15 items in the neurological examination stroke scale that used to evaluate the effect of acute cerebral infarction on the levels of consciousness. How is that consciousness? Whether consciousness is, the 0, whether he is unconscious. In all scales, 4 items are there. So whether he is fully conscious, whether he is unconscious, whether he is semi-conscious, all these things, scores are there. These scores we have to note down. So 0 means no stroke symptoms at all. 1 to 4, if at all you are calculating. So all these 15 items we have to calculate. In each item, there are 4 scores. And you have to calculate all the items and then come to the conclusion. If at all there are only 1 to 4, this one scales are there, then it is a minor stroke. If at all it is between the 5 and 15 scale, it is a moderate stroke. 16 to 20 is a moderate to severe stroke. 21 to 42 is actually severe stroke. In this way, now what we did is actually, in the first phase of treatment, when we took him, when the neurologist saw him, and then they actually graded this outcome parameter of the stroke scale as 25. We also understood that we went to them, we understood how to do it, and then we started actually adopting and then it was before the treatment on 12th, it was 25. 25 means, you can see, 25 means it is actually, it is a severe stroke. So 25. And after the treatment, it came down to only few things improved. So it became 20 on the scale. Second phase of treatment, he came. So he had improved further. Then, the before treatment of the second phase, it was 16. And then the second course of, when we completed the second course of treatment, it was actually 8. So in this way, he had improved. So when you come back again and see this one, so 8 means what? It is a moderate stroke. That means, he is still in the stroke with this one. He is able to walk. He is having some deficit, but it is not so severe. So when compared to this one, in this way, the NIH stroke scale, we also adopt. Now, I come to this particular point of Svedanam, Sneha Samyuktam, Pakshaghate, Virechanam. Svedanam, Sneha Samyuktam, Sneha Samyukta Svedana, and Sneha Samyukta Virechana. This is how the Chakrapani, the commentator of the Charaka Samhita, he has actually not explained, all the things why we have to do it, but he has given us some clue how to understand why this one. Because when we say the Sharira Janam, Doshanam, Kramena Paramaushadam, Bastir Vireko Vamanam Tatha Taila Gratham Madhu. Bastir Vireko. Basti is the treatment which is the Shodhana Chikitsa for the Vatavyadhi. Pakshaghata is a Vatavyadhi. He should not say that, he should directly say that it should, Basti is to be adopted, but he has actually told Virechana has to be done. Not only Charaka Samhita, but Vagbhata, as well as, Shushruta also have told Virechana. Then why they have told it, we were having a confusion. So we conducted a research, in my previous organization, I was conducting a research why this particular thing has been told. We had taken about 10 patients of this. We were getting large number of Pakshaghata cases. About 10 patients we categorized group A, 10 patients we categorized into group B, 10 patients in group C. Group A patients were given only Bastikharma, along with other treatment, Bastikharma. Group B patients were given only the Virechana Karma. And group C patients were given first Virechana Karma and then Basti Karma, both. So we saw the results. Based on that, I can tell you that why, Acharyas have told, but the results were actually in such condition, almost the same, little bit better, with the Basti and both Basti and this one, Virechana also almost the same. We were not able to conclude whether Virechana is good or whether the Basti is good or both. If we do it, whether it is good, yes. If we do both Virechana and Vamana, Basti Karma, that is having more effect than only Virechana and than only the Basti Karma, Basti Karma. Now let us understand, my few points I'm giving you. This is what I have learned from my teachers. Some 8 reasons I have given why we have to do the Pakshaghate, Virechanam. Snehana and Svedana cause Utkleshana and Dravikarana of the doshas. Virechana has a wide range of action to eliminate the doshas from the Amashaya as well as Pakvashaya. If you do Basti Karma, the Basti Dravya goes only into the descending colon, transverse colon and the ascending colon. It doesn't go beyond the cecum, beyond the ileocecal junction, it doesn't go at all. So it doesn't have any action on the Amashaya or in the intestine. But when we do Virechana, when we give the Virechana Dravya through the mouth, when it goes to the Amashaya, and this one, and also the Shudrantara, small intestine, and then it passes to the Brahadantra or the large intestine. So that has a very wide range of action to remove the doshas from the, so that's why Snehana Svedana, when it causes Utkleshana from any part of the body, even if it comes to the Kshudrantha, we have to eliminate it. So that's why this may be one of the reasons why, Virechana has been told. Shira and Kandara are Upadhatus of Rakta. Shira is actually, you can take it as the vein, or even the Dhamani we can take as a Shira, common word. And then Kandara, both are actually Upadhatus of Rakta Dhatu. Pitta is a Mala of Rakta. Pitta is a Mala of Rakta. Virechana acts on Pitta. it acts on Rakta, Mula Dhatu. Shira and Kandara are the Upadhatus, and Rakta is the Mula Dhatu. It is working on the Mula Dhatu also. So that's why Virechana is effective in Pitta, Rakta, and Shira, Kandara. So that may be one of the why it has been, for Pakshaghata. Head or the Indriyayatana, what we call all the Indriyas are Indriyayatana. Head is actually containing every part of our body function control. The control of all the parts of the body is there in the head only, is the Adhisthana of the Pakshaghata. Pakshaghata Adhisthana is head. And all the sensory and motor control functions are there in the head only. The Pranamata, which controls all the higher functions of the brain, is in the head. Mastishka is made up of Matulunga Majja. Shuddhamita says Matulunga Majja. The Matulunga Majja is almost equal to Majjadhara Kala. Majjadhara Kala is similar to Pittadhara Kala. So Pittadhara Kala, in Pittadhara Kala, any abnormality is there. So we have to do the Virechana Karma. So if we have to do the Virechana Karma for Pittadhara Kala, which is actually connected to the Majjadhara Kala and Matulunga Majja, that means that is one of the reasons why we have to do the Virechana Karma in Pakshaghata. Number 4, Pittanubandha. If Vata is, if Pakshaghata is only due to the Vatadosha, then it is actually Basti Karma is much better. If it is a Pittanubandha Pakshaghata, in Pittanubandha Pakshaghata, Kaphanubandha Pakshaghatas are there. So in Pittanubandha and Kaphanubandha also, Charaka has advised, we have to do the Mrudu Virechana. The Mrudu Virechana, whether we have to do the Mrudu Vamana. Mrudu Vamana is not going to act on any Pitta or Vata. Mrudu, Basti Karma, if at all Mrudu Basti Shodhana, if we do it, it may act only on this one. So it is not going to act on the intestine. So in such condition, we have to do Pitta in Pittanubandha and Kaphanubandha. Also, we have to do the Virechana, we have to do it. Number 5. Asya Upakramaha Snehaha Swedaha Samshodhanam Mrudu. As Virechana acts on, as I have told you earlier, it is a Mrudu Samshodhana, means Acharyas, they understand that. They also have said that Mrudu Samshodhana means it is a Mrudu Virechana. Pakshaghata may be due to either Dhatukshaya or Margavarana. And Charaka and also Chakrapani Datta and Dhallana have told, they have advised Mrudu Samshodhana as in Margavarana, Mrudu Samshodhana in Margavarana, and Virechana is considered the best Mrudu Samshodhana. Virechana drugs, they have, number 7 is Virechana drugs, they have Ushnashya, Tikshna, Sukshma, Vyavahi, Vikashi, these properties, and these properties, they act on both Amashaya and Pakpashaya. Hence, Virechana is has the wider range of action, in this one. Constipation is one of the common symptoms of Vatavyadhi. Constipation is, see, you all know that the Karsha Kashnoshna Kamitvam, Kampana, Hashakat Grahan, Balanidrendriya Bhamsha, Prata Madinata. Symptoms are one of the symptoms of constipation. So constipation, which is actually, usually they have constipation. In such condition, if you are doing only the Basti Karma is going to act only on this one. If the proper digestion has not taken place, and if the ama is there in the amashya and also in Kshudrantara or in the small intestine, you will not be able to eliminate only by the Basti. If you give Virechana, then it is going to act, improve the peristaltic movement, right from the this one, small intestine. So the Virechana is having wide range of action. Probably this is the reason why Acharyas have told, Pakshaghate Virechanam. I feel some of these things, according to my feeling, Pakshaghate Virechanam, this is only not forcibly, I'm not actually, convincing people to accept, Pakshaghata Virechana. If you all have any other idea about Pakshaghata Virechana, come and then let us discuss. And I hope I have done some discussion on this one, Pakshaghata. Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu ma kaschit dukkha bhaga bhavet. And I thank you very much for patient hearing, listening, and I open this for discussion.
Good evening, sir. Good evening, Dr. Bheema. That was a wonderful session. I would like to ask a question over here that you mentioned occurrence of Vedana in Pakshaghata. So if that occurs, would that be a case of hemiplegia or some immune-mediated motor neuron disorders like chronic inflammatory demyelinating polyneuropathy?
No. It cannot be, the other one, because we have all the symptoms of, Pakshaghata. And then this, usually people will not develop the pain in the beginning itself. People will, when the people, they come, they go to all other doctors and then they come to us. What happens actually by that time, because of this use, they don't use the muscle properly. And then the whole, the pain starts, and that kind of pain may be there. That's why it is called Ruja. From the beginning, usually people of this one hemiplegia, they don't have any pain at all.
Yes, sir. But if in Pakshaghata Vedana occurs, so it would be a case of CIDP, not of the hemiplegia.
No, see, it may not be, no, because, it is already established case of hemiplegia. If the patient is there with us, with all the, this one, with the, either the thrombosis or embolism or any such kind of thing, he is already there in front of us. We have diagnosed, and then all the symptoms of are there. Ruja is only a very simple symptom. So that, may not be, connected to the other disease. It is definitely this one. So no problem in actually this one. But for any other disease, they will be having their own other symptoms also. Those symptoms, if they are not there, we can conclude that it is only the hemiplegia. In hemiplegia, few people have actually pain because of their not using this one properly, and then the true drooping is there. And then that kind of pain is there, people have in, otherwise they don't have. And then people will be telling them, so you walk. So, and the physiotherapist also will be making him walk. He is reluctant to walk because, he is having so much of heaviness. In spite of it, he walks, then he will get pain later on.
Thank you, sir.
I have a question. What kind of exercise we can advise for Pakshaghata patients?
What kind of advice we can advise for Pakshaghata?
Exercise.
Exercises.
Exercise. Yeah, exercise in the sense, all the active movements. In the initially, only passive movements is possible. Active movements are not possible at all. And flexion, extension, supination, pronation, all possible exercises ought to be advised. But in case of hemiplegia, if the muscle power is zero, but the muscle tone is more actually. So we have to do the too much of extension exercises than too much of flexion exercises. These exercises. Even while doing the massage, we should not apply too much of oil on the flexor muscles. More on the extensor muscles, we have to apply the massage. And also, there is a way of actually doing the massage for different, for Parkinson's is a different type of massage is to be done. For the pain, a different type of massage is to be done, and also for neurological diseases, especially the upper motor neuron lesion diseases. When the spasticity is there, too much of oil application on the flexor muscle should not be there. But extension is most important than the flexion. They have to do the extension actually, and not only that, it is actually pronated. This is half flexed and pronated, we have to do the supination movement. Supination movement we have to do, and then we have to hold the hand like this, and then we have to hold the hand like this, for example, left hand. So we have to hold the hand like this and then do the movement like this. These are all the exercises to be done. And then facial exercises. They have to sit in front of the mirror, and then they have to see, and then they have to actually blow. They can't do it. And then they have to put this one, liquid in the mouth, this one, water in the mouth. They should actually hold it properly. That is also another, this one. What we do, in this one, we actually give Kshiramala Taila for, this one, Gandusha, and we tell them to hold it. They can't hold properly. And then the muscle, the facial muscles, how to do the massage in the facial muscles? They have to do the circular massage. From below upwards, they have to do it. From below upwards, they have to do it. So some of the technique of doing the massage is there. But unfortunately, in Ayurvedic, this one, all CGs, they do the same massage for, lower motor neuron lesion, same massage for upper motor neuron lesion, Parkinson's, and all these things. For proper training for how to do that's why I was stressing when I was talking, I was giving a lot of stress, yoga and also the vyayama. Allopathic side people, they say that our treatment is over. Now you have to do only the physiotherapy. See how much stress they put on this one. Even in Ayurveda, vyayama, particular vyayama, which muscle is having more weakness, which muscle is having this one. So we have to see accordingly, we have to do the exercise. That is how we have to do it. I hope I have answered your question.
Doctor, one more question. How can we do Pakshaghata for this patient? Because
Basti.
with the help of
Basti, you want to know how to do the Kashaya Basti, or what are the ingredients of Kashaya Basti?
No. How can we do? Because it is difficult for him to go.
Now I understand. How can we do? So it is very difficult to do the Basti in actually, if there is any incontinence of the bladder and bowel movements, then it is very difficult to do it. Virechana is very difficult to do it actually, but but still, when a person gets little control on the bladder and bowel, then we will be able to actually start the Yoga Basti. Till then, we cannot do any Yoga Basti. We tried our best actually to do only the Anuvasana Basti. The Matra Basti we tried, but still it comes out. It comes out. When it comes out, we cannot do it actually. So you try. That's why in our case, in this case, we did not do the Yoga Basti in the beginning itself. Then we started, now he is able to hold it. Then we started actually the first day we gave Matra Basti. Then, he was able to hold it. Then we gave the second day the Niruha Basti. He was able to hold it. We could do it.
Okay.
Dr. Bheema, congratulations for an extremely difficult case, but with very good outcomes over a period of time. And so I have two questions. First question, of different types of stroke changes or pathology that is picked up in MRI, ischemic stroke, hemorrhagic stroke, TIA, or through various reasons like a space occupying lesion or an aneurysm. Could be due to any systemic pathology like diabetes, hypertension, or road traffic accident, etc. Over a period of time, in your experience, have you seen that like with that change in systemic pathology, like hypertension leading to stroke or diabetes leading to stroke, while we understand that the final outcome, the change, what has happened in brain is important to tackle, but does the manifestation change with the underlying comorbidity that is there? And what different line of treatment can we choose? While we go on broad classification based on the outcome of MRI changes and type of artery or vessel involved, But does the comorbidity affect the change in plan, or should we consider that while we choose the chikitsa?
Yes, yes, yes. Thank you very much. See, definitely we have to consider this one. One is the Nidanarthakara Roga, diabetes, hypertension, all these things, Nidanarthakara Roga. We have to keep in the mind about these things also when we do the treatment for this one. So original disease also to be taken care, and then the second, the disease, independent disease, Pakshaghata also to be taken care. So the changes which occur in the brain, for example, those who are having a very hypertension, and because of that, see, they may not be having any diabetes, but the person has very high BP, and then he is having a hemorrhage. In such condition, the treatment will be definitely different. And a person who is having only clot, the thrombosis developing this one, and developing a stroke is a slightly different one. But first one probably maybe because of the pitta dosha. The second one probably maybe because of the vata and kapha dosha. So in this way, if we categorize and if we understand the dosha involvement, probably we will be able to do the treatment differently also. And then, other causes also, neoplasm, for example. So when we do the MRI and there is a neoplasm, we can actually take accordingly, we have to do the treatment. Not that, we have to do the Snehana Svedana treatment or any such kind of treatment. It doesn't work at all. In this way, the comorbidity also to be taken care. Even after the development of the Pakshaghata, we have to take care of both the things. Then only we will be able to understand the type of treatment which we have to do it.
So just the one point to clarify is, so my question was also that, will that comorbidity, by change in comorbidity, the outcome, whether it is leading to ischemia or hemorrhage, will it change the pathway? Because
not
we
much,
normally see
it has already taken place. The stroke has already taken place. Whatever was the reason, whether it was actually combined effect of the diabetes, combined effect of the diabetes and the hypertension and the dyslipidemia, whatever is there, but that stroke has already taken place. And then we have to treat that stroke. And side by side, we should not actually forget the original diseases also. Original diseases are also to be taken. One is the Nidanarthakara Roga. Nidanarthakara Roga also should be taken care. We have to continue to do it, because otherwise, he may have second attack. He may have one more attack after some time. So at least if we take care now, the first attack, if he improves, then he will be able to take care further. Probably the second attack may not be there. I have seen patients who are having 2, 3 attacks also, 3, 4 attacks also. Some people have it actually, especially the transient ischemic attack people. When they say they take it so easy, they understand that I have become all right, so I don't have any problem. But they should not actually leave the treatment at all. They should do the treatment properly to take care of the transient ischemic attack. Whatever is the disease has caused this one, but the outcome is actually the damage which has taken place in the brain. How much damage has taken place? Depending upon that, we have to do the treatment for the present disease without forgetting the previous reason.
Second question is on the Chikitsa Sutra itself about Sneha Sved Samyuktam Pakshaghate Virechana. While adequate Snehana and Svedana should be done, what are the safety measures that we should consider, considering the dislodge of thrombus emboli? And second question is that, in that Virechanam is considered as mostly Koshta Shodhana. In case of Pakshaghata, should we reconsider Virechanam as Shiro Virechanam as well? Because mostly that part of Virechanam is considered as only Koshta.
Yes.
And not Shiro Virechana.
In Chikitsa Sutra, I have actually mentioned that Shiro Virechana, Nasyakarma I have told. Nasyakarma, I have mentioned actually. That is called Shiro Virechana. Shiro Virechana, we have to do it. Koshta Virechana, we have to do it. Plus When we know that it is a Basti, Basti is the main chikitsa, we have to do the Basti also. We have to do Virechana also, we have to do the Basti also. That's why, from 1914 to 1917, I did a research taking, these three different category patients, 10 patients only for Virechana, 10 patients for Basti, 10 patients for Basti with Virechana. So Basti with Virechana patients, they responded much better actually. Shiro Virechana also is very important. Nasahi Sirasodwaram. Nasahi Sirasodwaram. We have to take care of this one. The further, when we do the massage, when we do the bhenga, we should take care of the thrombus, which should not actually cause any such kind of problem. How to reduce? When we give Ekanga Vira Rasa, when we give Ashwagandha, Manasamitrapati, and all these Kashayam and other things, that will also take care of further production of the thrombus.
Got it, Dr. Bheema.
Yeah, thank you very much.
So thank you very much, Dr. Bhatt, Dr. Ashwathi. We appreciate it. And we look forward to more such enlightening talks in time to come. So thank you very much. And we, from all of us, Dr. Abhilash, Dr. Jishnu, everybody just join us in applauding our team. Namaste.
Thank you, sir. Thank you very much. Thanks to everybody.